So rotator cuff problems and how to avoid surgery. We are not against surgery at all, not in any way, shape or form. I've said that before, but I do think that it is best to exhaust all options before undergoing surgery. It's pretty much the last resort. And there are other options with things like rotator cuff problems. And I think that they should be exhausted and explored and exhausted first before considering surgery, which is an incredibly invasive procedure. So firstly, what is a rotator cuff problem? Well, a rotator cuff problem is a problem with the shoulder. Okay, so people complain or diagnose you with a rotator cuff problem. It's the muscles in the shoulder. There are 4 muscles in the shoulder that are deep, and they control the use of the humerus, so the arm bone within the ball and socket joint of the shoulder. Okay, they are quite commonly injured, and it can be a cumulative thing. It doesn't have to be an actual one-off injury. It can be a cumulative problem. So it can have kind of manifested over time. Okay, and typical signs. So typical signs of a rotator cuff problem are things like certainly raising the arm up, real problem with raising the arm up, just generally lifting, trying to get things. So if you're doing weights in the gym and you're getting problems with overhead sort of activities, trying to get glasses or cups out of cupboards. So anything overhead, when you're doing that and you're having aches or pains in the shoulder, that can be a sign of a rotator cuff problem. Other signs are things like arm behind the back, so things like doing your bra up, or putting coats on or off, taking t-shirts and jumpers off, that sort of thing, grabbing the seatbelt in the car. These are all signs of a rotator cuff problem. So if you just put your arm to the side, and as it comes up, if you're feeling around sort of the 90-degree angle, there's a pain, put your arm in front with your thumb pointing down and push up into your other hand. And if you're getting a little bit of getting a pain in the shoulder, then that, again, these can all be sort of signs and indications of a rotator cuff problem. These can be treated by exercise therapy reasonably successfully, but also we're finding in clinic successful treatment with shockwave. It's been really effective, and it enhances the exercise. We do exercise as well. So what we do is we do a course of shockwave therapy for 3, 4 or 5 treatments. And then we do exercise therapy after that, and that just seems to enhance the whole process. And we are getting patients avoiding surgery, which is a good thing. We like that. So if we can get help, potentially help you, then give us a shout. It would be great to see you here to see if we can help.